Okay. Good afternoon. My name is G.K. Manius, and I'm with Tarrant County. And I'd like to first of all thank you for meeting with us today and just some little bit of information as how we're going to move forward on this presentation. First of all, it's our intent to hold a conference at 1:30, Monday through Friday, in the Commissioner's Courtroom to provide briefing information to the media as it relates to the H1N1 influenza. If there's a need for us to hold a conference on either Saturday or Sunday, we'll notify you and in a timely manner, and that will also be at 1:30. But it's our intent to have this news conference Monday through Friday at 1:30 in this particular location. Before we get started, I'd like to introduce several people that are in the audience. We have County Judge Glenn Whitley is with us. We also have Commissioner Gary Fickus, both of our court members, and I know that they'll be available later on if you'd like to talk with them. Where we'd like to start this presentation today is that I'm going to introduce Lou Brewer, who is our Director of Public Health. She is going to give you an overview of the situation as we know it today. Dr. Parker will then follow her. Dr. Parker is our health authority, and Dr. Parker will be here to answer any questions that you may have. I might just say that the presentations or the conferences that we're going to hold Monday through Friday are simply going to serve as an update. And I don't know if they're going to take very long, but we're going to tell you the latest and greatest, basically, of what we're seeing and how we're dealing with it in Tarrant County. So with that, I'd like to introduce Lou Brewer, our Director of Public Health. Lou.
Thank you, GK. Good afternoon. I'm glad to have the opportunity to speak to everybody in Tarrant County. We have been keeping you informed during the week at various news conferences and with press releases. We do now have a fact sheet that we're putting out an update every day at 3 o'clock. Since it's not 3 o'clock yet today, I'm going to be talking to you about the fact sheet that we put out yesterday. As you've been hearing all week, this is a very fluid situation, and we want to keep our facts as straight as possible and as accurate as possible. So based on our update of 3 o'clock yesterday, and you'll be getting the new one in a couple of hours, we have 5 confirmed cases in Tarrant County and 15 probables. We reported that we had 2 locations, 2 confirmed cases in Euless and 3 in Fort Worth, and I have an update on that one. The age range for the confirmed cases was 11 months to 37 years. The onset of illness dates ranged from 4/20 to 4/26. We had one school with confirmed cases. That has changed. Fort Worth ISD McLean Middle School. None had a travel history to Mexico, and we had 2 confirmed cases that are a mother and son. The probable cases, that's the 5, 2 locations, Euless, 1 probable, Fort Worth, 9 probable. 5 probable cases still under investigation, and that may be included in the update this afternoon. Age range 2 years to 34 years, onset of illness 4/22 to 4/27, and 4 schools with probable cases, all in the Fort Worth ISD at that time. 3 probable in South Hills Elementary, 1 probable in Westcliff Elementary, 2 probable in McLean Middle School, 1 probable in McLean 6th grade, and 1 probable with a travel history to Mexico. This is a good time for me to say that we've been hearing from some other independent school districts that parents are very, very anxious and concerned. We made the decision we made the recommendation and advised the decision makers on the closing of the Fort Worth ISD. That's raised questions from other people about why don't you close my school? I've just given you the information because we had probable cases and one that confirmed. We do not have that situation in other school systems. And so what our recommendation is to maintain that higher level of alertness and attention to whether you have any symptoms. If you have symptoms, to see your doctor, to stay home. But until we know that we have a case in a school, we are not talking to a school about closing. Now here's the update from this report. Late yesterday, we had one confirmed case that we had no identifying information for, or that information was erroneous. We found that person late yesterday, and that resulted in the closing of the Shannon Learning Center in the Birdville ISD. It was an employee, not a student, and we're working with the ISD on the contact investigation. So that changes. We now have 2 ISDs, but only one school in the Birdville ISD that's closed. I'll now turn it over to Dr. Parker.
Thank you, Lou. I just wanted to address the position of the health authority because some people may have questions. The health authority position is defined in the Texas Health and Safety Code. Generally, it deals with the control of contagious disease. Over the last couple of days, several agencies have worked to respond to the current situation. As the medical director of Tarrant County Public Health, I recommended not holding certain events because of the potential of spreading illness. While some have characterized my statement as an order, it is best described as a recommendation. My recommendation is a precautionary measure based on my medical expertise and opinion and is not intended to alarm anyone. For questions regarding whether a particular event is canceled, the entity in charge should be consulted about that event. Some other questions have arisen as to why the Fort Worth Independent School District was recommended to close. It was recommended to close to prevent the further spread of disease as a precautionary measure. According to the criteria that we had available at the time, the cases that were being identified in that school and in that school district justified that recommendation for closure. The recommendations for closure are changing constantly. The CDC has just recently issued some new direction, and as with other local health officials and independent school districts, we are awaiting further information from the Department of State of Health Services regarding those recommendations. Other questions that have been asked are how is this virus transmitted to surfaces and to other people? When an infected person coughs or sneezes, the moisture droplets are passed on to their hands or the surfaces of objects. When an individual touches these objects or their hands, they pick up those germs, and then they can spread that infection by touching their mouth, nose, or eyes. That's why we recommend good cough and sneeze etiquette. Other questions that have been asked are how do I disinfect surfaces regarding the virus. You can follow the label instructions on any disinfectant or cleaner, and you just use a household cleaner and clean those surfaces. If you don't have a disinfectant available, you can use a chlorine bleach solution. And if you need more information about that, that is available at the CDC website. It is also the Tarrant County Public Health recommendation that you continue to practice good cough sneeze etiquette, frequent soap and water hand washing or the use of alcohol sanitizer, and stay at home and avoid work or school activities if you are sick.
You have questions?
Our station's website is getting bombarded with questions from the public, particularly about the cancellation of Mayfest. And one of the questions that we see quite often is, why do you force the closure of Mayfest, but Fort Worth Zoo, right down the road, is still open in the same area, which would attract the same amount of people? Even rainbow games, stuff like that.
Right, I understand. Again, we didn't force the closure of Mayfest, but to prevent the further spread of illness, we did make that recommendation. And that recommendation was specifically made because the intended audience of Mayfest would likely be a number of Fort Worth Independent School District children, and because we made the recommendation for them to stay at home and basically self-isolate them, we felt that it was important to make the recommendation regarding that event.
But doesn't that send a mixed message then? I mean, wouldn't there be a lot of school kids, I mean, particularly from Fort Worth, also going to the zoo or Rangers games or, you know, and people are trying to figure out what do they do when some venues have been shut down and others are open.
Absolutely, and yes, it is confusing, but that was exactly the point, that we did not want to send a mixed message regarding Mayfest. I think it would have sent a mixed message for you to close the school district and not make a recommendation, make a recommendation to close the district and not make a recommendation regarding Mayfest or other gatherings. The question lies is if it is specifically intended to attract Fort Worth ISD students who we have identified at this point as a high-risk population. Yes, I do understand that the zoo is in close proximity, and we have had communications regarding the zoo, but we have not made a recommendation as of yet. I've also been in communication with the City of Arlington Health Authority regarding the statements that I have made regarding Mayfest and other events here in Fort Worth. But as of this point, there hasn't been a recommendation regarding the venues in the City of Arlington.
But again, how do you leave the zoo, Six Flags, and the Rangers games, leave them open, and then cancel the Mayfest?
Again, specifically regarding Six Flags and the Rangers game, those events are not in my jurisdiction. Regarding the zoo, we are in communications regarding possible recommendations regarding the zoo. And it must be understood that the recommendations regarding closure of different gatherings and events are changing constantly as well. So based on the criteria that we have at the time are why we're making certain recommendations.
Do you think there's a possibility that you could recommend possibly closing the zoo?
Yes, there could be that. I'm not saying that that we have specifically discussed that at this point, but there are new recommendations out, and we, as I mentioned, we are waiting for further guidance from the Department of State Health Services.
What are you telling the zoo to do? Because they're saying they haven't heard from you about specifically what to do except, you know, the hand sanitizer and...
Well, that's the most important thing to do right now is is to follow the recommendations that we have issued. If people are ill or their children are ill, they should stay at home. Good hand washing with soap and water or having hand sanitizers available is appropriate. Also covering your cough or your sneeze.
But the zoo specifically, what could the zoo as an entity do besides making sure that those sanitizers are on property somewhere?
As far as nothing other than what we're recommending for other facilities, which is the having the hand sanitizers and frequent and stations available to wash your hands. And it's not necessarily recommendations to the facilities, but recommendations to the people who would likely attend those facilities. If you are ill or you don't feel well, you should not be out.
Dr. Parker, you said that there have been some new guidelines that have been passed on. Can you give us an idea of what those new guidelines are?
I didn't bring those with me, but they're on the CDC website regarding school closures, and there are some recommendations that possibly would increase the scope of recommending closure for different areas.
And when you guys recommended Fort Worth ISD closed, did you guys also suggest the amount of time to be closed, or was that determined by the district?
We did that together. It was a collaborative effort.
What went into that decision? I mean, a week and a half. I'm just...
Sure. The information that goes into that decision is when the last case was diagnosed at that facility. And what we try to do is use 2 incubation periods of that virus so that we don't have somebody who you don't want the children to come back too early. And so you take the average incubation period, and it was doubled, and that's how we came about that decision. We also did include weekends in that. And those guidelines are changing as well. Previously, it was 2 incubation periods. There may be, there likely will be new guidelines as to, should it be closed for a minimum of 7 days? Should it be something else? But that's changing frequently as well. Again, this is a new virus. We don't know very much about this virus yet, so the information is coming piecemeal and everybody is adjusting to that.
Dr. Parker, maybe it'd be helpful if you explain in what areas you have authority to tell someone you should shut down, like restaurants or daycares. But then beyond that, are you just giving recommendations to governments or school districts or businesses that ask for them, or are you sending recommendations unsolicited to anyone?
No, most of the recommendations that we have, or actually the recommendations that we have issued have been solicited. Now, regarding the first question is about how can I order different facilities to be closed, restaurants or something like that. If there is a violation of the Texas Health and Safety Code, then there are provisions in there to make an order to close a certain facility. Now, I cannot go into detail about those specific laws. I do that in conjunction with Environmental Health Services and in the Tarrant County Department of Public Health. So, and then I don't. You had a first question to that as well. We went backwards.
Well, I was sort of just trying to ask you to help us get a sense of where your authority begins. It sounds like you talked about a collaborative effort and making recommendations, but can you go out to the Rangers, for instance, and say, I recommend that you close. You have too many people gathered in one place.
Well, no, not specifically to the Rangers, because again, the ballpark is not in my jurisdiction. The City of Arlington does have their own health authority. I can make recommendations, and I've been in communication with the City of Arlington Health Authority, but we have not made any of those recommendations yet. Regarding that, I would like people to understand that to this point, there have been no confirmed nor probable cases in the City of Arlington, and so that has to factor into the decision where your cases are located and the situation in the area, and that specifically would address the reason for the Fort Worth Independent School District.
Dr. Parker, there are 25,000 free and reduced meals served every day in the Fort Worth school system. Have you given or had you given any thought to how those children who need the food will get food because they can't get it from the schools now?
Yes, that we did think about that when we were in collaboration with the Fort Worth Independent School District. I can't say any more information about that, but that was discussed. This decision was not made lightly. We did try to identify all of the issues associated and the impact it would have.
Did you make any provisions for them?
No, I did not make provisions for them specifically.
Because the school district says it hasn't done that either. So what's the answer to that?
I don't have an answer to that.
I mean, you're taking a lot of flack and a lot of criticism for closing Mayfest and the schools because, it's causing a lot of hardship on parents who maybe don't have money for extra daycare or like David was talking about, the meals. I mean, do you deserve it? Do you deserve the criticism?
Well, when you make a recommendation, then you have to realize that it's going to have impact. Tarrant County Public Health has not been isolated from the decisions that we've made. I've made the recommendations based on the information that I had available, the knowledge and the expertise that I have, and I have to live with what comes with those decisions. I feel confident in the decisions that we've made. But yes, I realize that they create hardships. That's not the intent of the decisions. The intent of the decisions is to promote and protect the public health.
Dr. Parker, we're seeing some information from CDC and some other medical authorities that the virus will only survive about 48 hours outside the body. What are sound or prudent measures for disinfecting? Schools have shut down. They're out there disinfecting right now. What's the point of that? The kids aren't going to be there for 2 weeks. And kind of what is a better procedure for for disinfecting in terms of the incubation period and the time period that the virus will survive outside the body?
Incubation period only applies to the human body. Well, in your question, it's best limited to the human body. Now, regarding on surfaces, the point of cleaning, even though the students are going to be out for next week, is a precautionary measure. Because yes, 48 hours is the average time, but that's also the information that has been used based on regular influenza or other viruses. This is a new virus, a new strain of a virus, so we don't know specifically. So the recommendations for disinfection are precautionary.
Could you have taken this on a case-by-case basis?
We have taken it on a case-by-case basis.
But you closed all the schools.
Yes, based on all of the information available for the schools. We made the recommendation to close the district. The criteria at the time that we recommended the closure of the school was one confirmed case and other probable cases in different schools. We had that information.
So the combination of more than one school?
Yes.
So
Yes.
having it in more than one school would require closing all of the schools together?
Yes. I mean, you can try to geographically limit the closure of the school. You can try to do a feeder system, but in our communications and our work with the Fort Worth ISD, it was determined that we didn't think that could be possible, and so it resulted in the closure of the entire school district.
Because of the more than one school, that was the recommendation from the CDC?
Yes, with cases in more than one school. And also, I just wanted to point out that we didn't set the precedent for closing a school. It just happened that we did it on a larger scale. This is the criteria that Guadalupe County used as well. When they had one case in one school and it was determined that they had other probable cases in another, they did close. Granted, it did not have the impact that it had here in Fort Worth and Tarrant County, but we didn't set the precedent on that. And they used the best information that they had available as well. I would agree with the decision that they made.
And you plan to let this stand for this length of time? I mean, is there any consideration given to sending them back to school Monday, or?
No, not at this time. Because again, we base the recommendation for closure on when the last case was diagnosed, when they were symptomatic, and then we go with the recommended time for following the incubation periods and the possibility of someone becoming sick and then exposing others. If the children return to school too early, then they could still spread disease if there's someone there who is infected but not yet symptomatic.
The criteria is the same today?
The criteria,
If you were to make the decision today, the criteria is the same today, or has that changed?
well, actually, it's changed as about an hour ago. It's actually more broad and could allow greater closure. So if I made the decision today, it might be different.
Great. I mean, how can you can't close the school twice, though? I mean,
No, I mean that you might feel it necessary to close neighboring districts or something of that sort.
So
I cannot address that at this point. Again, I said that there have been new recommendations from the CDC, and we're waiting for further guidance from the Department of State Health Services regarding the new recommendations. Again, the recommendations are recommendations.
But the broader,
And so
broader closure.
For broader closure.
So you will reevaluate the new recommendations based on the information you have?
Yes,
One
but it is.
possibility is more closures.
Yes, but it is on a case-by-case basis based on the situation in the location that you are working with.
I'm sorry, I just want to ask it one more time. So based on the information of the one case and the other probables in Fort Worth, you could conceivably, under the new guidelines, recommend closing other neighboring school districts that don't have any confirmed cases?
Yes. But I'm not saying that I'm doing that. I want to be very clear. Those are new recommendations that are being taken under advisement, and we're waiting for further guidance from the Department of State Health Services.
GK gave me a good explanation yesterday of how the criteria has changed, the guidelines from CDC, and it seemed at the time when the schools were closed, you seemed to take a more cautious or conservative approach to the closure around some of those schools or from the school district or from this area, we haven't seen a number of pending tests that are at CDC. In other words, the cases that were suspect, and that you have passed on to the CDC, how many tests are CDC's cumulatively holding still beyond the 15 probable that have returned and the 5 confirmed that you have on the list?
If they're confirmed, the CDC is finished with those tests. So the CDC, they have specimens, but they're not working with those any longer. The CDC currently has 15 from Tarrant County.
That's the total number that are still pending.
The total number that are still pending from the CDC. I hesitated because our lab is a part of the regional laboratory, and I wanted to make sure that I had the number correctly.
So it's
But-
15 probable cases in Tarrant County right now.
In
Is that
Tarrant.
9 in Fort Worth and 1 in Euless? Is that correct? Is that what you were saying?
That would only make 10. Let me let her do that.
Or the other 5?
Yeah, uh-huh.
Lou, do you want to answer
They
that
were,
question?
they were the,
Lou, why don't you come up to the mic?
okay. Tell me your question again. This is where we have to kind of, okay. Ask me your question again.
Well, you said 15 probable cases, and when those numbers were coming off, I was going pretty quickly. I thought there was 1 in Euless and 9 in Fort Worth.
Yes.
Where are the other 5?
They were still under investigation as of yesterday, so in the 3 o'clock report today, we should have that for you. We didn't know, we don't know we didn't know that information yesterday. That's what our contact investigation is trying to find out.
Lou, maybe you could address what you're doing in terms of the Spanish-speaking community, what efforts to get all of these messages out to the bilingual community,
Okay. That's an excellent question. We've been real concerned about that. We have translated the materials we put on the website, or I hope most of them, if not all of them. We have done some interviews for the media outlets, and we do have phone people that, we have a whole bank of phone folks, and we do have people that are bilingual.
So the phone banks, I mean, are they just randomly calling people, or what's their target audience for the phone banks?
Oh, they're not calling out. This is for people calling in with questions, yes.
So, Dr. Parker, did you say that it was the CDC's recommendation that Fort Worth ISD closed down?
No, it was my recommendation to the,
From
It-
CDC to you?
no, that was not from CDC to me. It was my recommendation to the Fort Worth ISD regarding school closure. I based it on CDC criteria, but that was not a direction from the CDC. The decisions are made locally.
And Dr. Parker, was it your recommendation on cleaning the schools in the manner that they did?
Yes, we discussed these things about what other measures should be taken following the school closure and for how long the schools should be closed. It was a collaborative effort. Much time was put into that decision.
So, I'm sorry, I didn't quite understand medically if the virus only survives 40 hours and the students aren't going to be there for 2 weeks. I guess I didn't understand medically what was the recommendation for disinfecting an area where the virus is going to die.
It's precautionary. People will feel better if the area is cleaned.
What's the perception more so than medical?
Yes. But again, I did say that it was a new virus, and we don't know how long that it would live on surfaces. But
But you think 48 hours?
we think 48 hours at this point.
Okay.
Can you compare this to anything you've seen before? I mean, in the past, for those of us with short memory, is there anything this reminds you all of or you've seen before?
I'll let Ms. Brewer answer that question because I have only been with the Tarrant County Public Health Department for a short period of time.
Are you talking about what we've experienced here locally?
Well,
Or-
just this outbreak. Someone said that we had a swine flu outbreak in the late 70s or early 80s.
Oh.
I don't personally remember it, but I mean, have we seen something like this before?
Right. And I'll have to speak historically myself. Back in 1918, we certainly saw something like this. And since we've been concerned about pandemic flu, we've really been studying what happened then. And of course, the whole healthcare system is different. The health of the population is different. Our access to healthcare is different. But what happened and what were the mitigation responses to that. And we have seen that different cities responded differently. And the ones that were out there and willing to do some of the things that we've done here for our city of Fort Worth had fewer sick people. Yes.
The public health department going to offer any free antivirals or any free flu testing to people who are indigent or maybe don't have health insurance? And are there any efforts to try to reach out to that part of the community? As 1 in 4 people who are uninsured, so a great number of people who either aren't seeing doctors or maybe aren't willing to go somewhere because they don't have needs.
That's an excellent question, and we have been asking ourselves that question all week long. More around the getting the medication. We're just taking it case by case right now. I can tell you that when on an average day, we run into this situation frequently, and we take it case by case. Depending on what the situation is, we can look to different partners in the community and work something out. So, our case managers that are working with the contact investigations, they will do everything they can to make sure that people get their medication. As far as your other question, we're getting feedback from the schools. If they're seeing a lot of sick people, they're calling us and saying, they're giving us a read on whether they think people are able to get treatment or not, too, and we make some recommendations there. I'd love to have a better answer than that, Tony, but we are sensitive to it, and when we're working on the contacts and the treatments, we do that case by case.
Kind of piggybacking on that, do you have adequate supplies of what you think you're going to need if you had to give out some of this?
For the situation right now, we believe we are okay. And we're in constant communication with our regional office, the state regional office, and the state of Texas regarding supplies, because everybody is keenly aware of that and keeping track.
Just have a few comments yet, actually 3 different comments. First of all, Tony, to address your issue as far as those individuals who may be either underinsured or non-insurance, we are working jointly with JPS. In fact, I talked to the executive director, the CEO, this morning and discussed that particular issue, and there will be no one turned away for any testing if they present themselves at JPS. So we're working with our partners on that particular issue, and I believe that we have a solution for that. There's a question that, ma'am, that you asked about any regrets about the decisions that we made. Quite frankly, we have no regrets what the recommendations of the Public Health Department has been. We work in close collaboration with all of our partner entities. I will tell you that as it relates to the Mayfest event and also the Cinco de Mayo event, that our staff, our public health staff, our administrative staff worked with the city of Fort Worth in consultation and in actual meetings probably for 5 or 6 hours over a 2-day period before we made our recommendation to the city. And the same thing goes with the Fort Worth ISD, that we were in constant consultation with Dr. Johnson. We advised her of what we saw. She asked an opinion of the State Commissioner of Education and also the State Commissioner of Health, and in consultation with those 2 entities and the Public Health Department, she made her recommendation, which we believe is the correct decision to make. As far as keeping kids out of school for a certain period of time, when you really look at it, what we're talking about is keeping kids out for the remainder of this week and next week. And we honestly believe that keeping kids home for 8 days to have a greater probability that they don't catch this disease where there's no cure right now is a wise and prudent choice. And finally, we talked a little bit about some of the additional data that will be ready by 3 o'clock this afternoon. The reason we don't have it ready for you now, we're still compiling that information. You'll be able to pick that up on our website. And talking about our website, we are expanding our website so that we'll have more current information. We intend to update the website at least twice a day with greater information, and all of our press releases or news releases that we have will be on that site. Hopefully, as we move forward on these daily briefings, that is Monday through Friday, that we will have a more up-to-date information for you. Hopefully, we can get the information that we're going to release at 3 o'clock to you at this time. So that's where we are now on this. If there aren't any additional questions, then we thank you for your time today, and we're excused.
Thanks.
It'll be posted on our website.
And I'll send it out, we'll email it to your station.
So, Mark,
No one's died.
No one has died. No one has been hospitalized. No one has been hospitalized for this in Tarrant County.
For 5 cases that you asked, that
But I will put you
Yeah,
on
you
my
can just go
list.
ahead and put me on. I'm sorry.